Sri Kerman Shila, Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 10 lakh be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending the 31st March 2024 for the administration of heads 2029 land revenue.
Motion moved. Since there is no cut motion against this grant, let me put a question before the House. The question is that grant number 1 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 1 is passed. We will now take up grant number 2. Sri Singobalang Dhar, Deputy Chief Minister, to move, please.
Mr. Speaker, sir, the recommendation to Governor, I beg, sir, to move an additional amount of 20,16,186 be granted to the Minister in charge to defray certain charges which will come in the course of payment in the year ending 31st March 2024 for the administrations of the Head 2041 taxes on vehicle, 2070 other administrative services, 5053 capital outlay on civil aviation, 5055 capital outlay on road transport.
Motion moved. Since there is no cut motion against this grant, let me put a question before the House. The question is that grant number 2 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 2 is passed. We will now take up grant number 3, demand number 3. Sri Abu Tahir Mondal, Minister in charge, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of rupees 100 crore be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending 31st March 2024 for the administration of the heads 2501, special programs for rural development, 2801 power, 4801 capital outlay on power projects.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 3 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 3 is passed. We will now take up demand number 4. Sri Alexander Lalu Hek, Minister, to move, please.
Honourable Speaker, sir, on the recommendation of the Governor, I beg to move that an additional amount of ₹66,98,666 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending 31st March 2024 for the administration of Heads 2052 Secretariat General Services.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 4 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 4 is passed. We will now take up demand number 5. Sri Conrad K. Sangma, Honorable Chief Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 8,55,26,550 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending 31st of March 2024 for the administration of the Heads 2053 District Administration.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 5 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 5 is passed. We will now take up demand number 6. Sri Conrad K. Sangma, Honorable Chief Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 15,65,000 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending the 31st of March 2024 for the administration of the heads 2054, Treasury and Accounts Administration.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 6 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 6 is passed. We will now take up demand number 7. Sri Preston Tingsong, Deputy Chief Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 20 crores 18,10,303 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending 31st March 2024 for administration of the head 2055 Police, 2070 Other Administrative Services, 4055 capital outlay on police.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 7 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 7 is passed. We will now take up demand number 8. Sri Preston Tingsong, Honorable Deputy Chief Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 43 crores 78,54,178 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending 31st March 2024 for demonstration of the head 2052 Secretariat General Services, 2059 Public Works, 2216 Housing, 4059 Capital Outlay on Public Work, 4202 Capital Outlay on Education, Sports and Arts and Culture, 4216 Capital Outlay on Housing.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that the grant number 8 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 8 is passed. Now we will move to demand number 9. Sri Kamingwan Mbom, Minister in charge, move please.
Honorable Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of ₹1 crore 88,33,459 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending the 31st March 2024 for administration of head 2070 Other Administrative Services.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 9 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 9 is passed. We will now take up demand number 10. Sri Rakham A. Sangma, Honorable Minister, to move, please.
Speaker, sir, on the recommendation of the Governor, I beg to move that an additional amount of rupees 213 crore 75,83,617 be granted to the Minister in Church to defray certain charges which will come into course of payment during the year ending 21st March 2024 for the administration of the heads 2202 General Education, 4202 Capital Outlay on Education, Sports, Art and Culture.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 10 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 10 is passed. Now we will take up demand number 11. Sri Rakham A. Sangma, Honorable Minister, to move, please.
Speaker, sir, on the recommendation of the Governor, I beg to move that the additional amount of rupees 8 crore 59 lakhs 96,069 be granted to the Minister in Charge to defray certain charges which will come in the course of payment during the year ending 31st March 2024 for the administration of the heads 2070 Other Administrative Services,
2216 Housing, 2235 Social Security and Welfare, and 345 Census Survey and Statistics.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 11 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 11 is passed. We will now take up demand number 12. Sri Conrad K. Sangma, Honorable Chief Minister, to move, please.
Mr. Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 39,46,685 be granted to the Minister in charge to defray certain charges, which will come in the course of payment during the year ending 31st March 2024 for the administration of the Heads 2251 Secretariat Social Services.
Motion moved. Since there is no cut motion against this grant, let me put the question before the House. The question is that grant number 12 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 12 is passed. Now we will take up demand number 13. Dr. M. Amprin Lingdo, Honorable Minister in charge, to move, please.
Honorable Speaker, sir, on the recommendation of the Governor, I beg, sir, to move that an additional amount of 75 crores, 28 lakhs, 6,724 be granted to the Minister in charge to defray certain charges which will come in the course of payment during the year ending the 31st March 24 for the administration of Heads 2210 Medical and Public Health, 2410 Capital Outlay for Medical and Public Health, sir.
Motion moved. Now there is one cut motion against this grant tabled by Dr. Celestine Lingdo, MLA, and Dr. Mizanur Rahman Kazi, MLA. Any one of you can move.
Mr. Speaker, sir, I beg to move that the total provision of 75 crores, 28 lakhs, 6,724, supplementary demand number 13, head 2210, medical and public health, at page 35 of list of supplementary demands, be reduced by 100 rupees. That is, the amount of the whole supplementary demand of 75 crores, 28 lakhs, 6,724 do stand reduced by 100 rupees.
Motion moved. Now you may initiate discussion.
Mr. Speaker, sir, when I bring this cut motion, it is not an issue about the amount mentioned here. It is just an issue to settle maybe the long pending issue which should come first, the egg or the chicken, at least for the health department. To put things in perspective, I would like to narrate a story. When I was a medical officer in 1998 in Umsning, I presided over a program where the MLA at that time of that particular area organized a public meeting where a sub-center was constructed 5 years before that program, but it was not made functional. After that program, an order has been made that it has to be repaired. That was in 1998. 1999, I went for my MD. I came back to Umsning as a medical officer again. In 2002, that same sub-center that was repaired was in dilapidated condition. Again, there was a program that it should be open, and it has to be repaired again. It had to be repaired twice before it was made functional. So I bring this point here, not because I have any issues with anything. In fact, I am very delighted and happy to see here in the explanatory notes, point number 6, to see that upgradation of Milim Umthlong Subcenter to 10-bedded PHC, upgradation of Saunangbri Subcenter to PHC, and upgradation of Shangpung PHC to CHC. We are very happy about this. But the question I want to raise here, or maybe put suggestion to the government, can we simultaneously, if we decide that Sao Nongbri PHC should be upgraded to a PHC, can we start appointing doctors to function at this sub-center and start working while simultaneously the work at the PHC infrastructure is being done? Why I say this? There are many instances where medical infrastructure like a PHC building has been completed, but 5 years down the line after completion, there is no manpower. In fact, the other day, the Honorable Minister has said, when Honorable MLA from, I forgot the constituency, but from Jaintia Hills raised about the possibility of opening a medical college in Jaintia Hills. The answer was a big no because HR issues, human resources. Here, if we change our approach, now in an existing sub-center where a nurse or NM is functioning, if we start appointing doctor, prospecting that it will be upgraded into a PHC, the doctor can start working in that sub-center. I think that will give the sub-center a super structure, super service at the level of sub-center. And meanwhile, while the construction is going on, all the human resources required can be done simultaneously. Why I raise this issue is that another example that I will be giving is the MCH hospital in Parila, where I represent. By the time we make it operational, sir, Mr. Speaker, sir, this center also, the staff quarters will have to be repaired because they were completed 2 years ago, and in between there are some thefts, some wiring is missing, some doors are rotten. So by the time we inaugurate or we make the infrastructure operationalized, it will take another 6-7 months. So this is the time gap which I would like to request the government to bring down. The time gap between completion of the health infrastructure and the time that we make it operationalized. So this time frame has to be reduced so that we don't spend unnecessary amount of money in repairing what has been constructed before inauguration. So here I would like to stress that is the main point, and I would like to request human resource is in fact the most important component when we talk about health delivery services in our state. We discussed this morning also about setting up medical colleges. There's no harm in it, but when we start, where do we get professors to do the teaching work? Now we will not go to medical college, we will go just for the basic infrastructure. Please close this gap so that there will be no wastage of public money. And we expect that when works are allotted and upgradation is announced, the general public also should be informed so that they know what to expect out of all those constructions. These are the few points I want to raise, and I'm sure the Honorable Minister is here. The CM has promised during his reply in the debate on the Governor's address, the MCH hospital in Parila will be functioning soon maybe, but then there also I hope that issue of human resources will not be a hurdle. Maybe in 4 or 5 months' time, we can solve that issue and make that center functional. These are the few points I would like to raise during this cut motion, sir. Thank you.
Any other member to participate? Dr. Mukul Sangma, please.
Mr. Speaker, sir, I rise to support the cut motion tabled by Honorable Member from Pumsning, Dr. Seelinger. A very important sector, health. I think we are all affected by this particular sector, every member of this August House. I think every day we do when we interact with our electorates, with friends, this particular sector becomes one of the sectors which draw our attention. In fact, today also when I was receiving some calls from the area, I was privileged to get some more inputs. Now, we look at that the intent of the government is to really ensure that the patients do have access to free medicines in the respective healthcare facilities that we have created across the state. That was one of the programs that we initiated, that every patient, whoever come for accessing healthcare facilities in the state institutions, medical institutions, must be provided this support, keeping in mind the number of people who are poverty-stricken, and therefore they do end up coming to the elected representatives, whether it is members of district council or members of this August House. We are well seized of this very important issue. I'm happy that allocation of fund is being sought for additional amount, in addition to what has been already provided. And in fact, even in the last preceding quarter, we saw similar amount, additional amount being sought for to cater to the needs of medicines in different medical institutions of the government. Now, the problem here is that the medicines which are being prescribed, medicines which are being provided, I think it will be appropriate, since huge amount of money is being spent from the public exchequer in order to take care of the support that we want to provide to the patient parties, so that they don't have to spend their money for the purchase of medicines prescribed by the respective doctors. So the overall system, if put in place, will be very appropriate for the department, and also will enable the department to know where there's a gap, which are the hospitals which are submitting their indent to the respective concerned authorities who would take care of their indents as far as the need of the medicines are concerned, and who are not. It's crucial. Why I'm saying this is because when patient parties talk to us saying that we need money for medicine, purchase of medicine, that means we know that medicines, even the purchase of medicines, the burden is still with the patients, the patient parties. So when we further want to know, then sometimes, there are irregular answers from different medical and health officers. Some have, some don't have. Why don't some don't have? Because they do not take care of the timely indenting of the medicines. Government is providing, we are passing this, whatever is being proposed before this August House. We are voting. Money is being given from the public exchequer. But if at the time of utilization of this benefit, if it is not passed on in an equitable format, then some areas, so people are not aware that, okay, the hospitals are still providing that, free supply of medicines. We are spending, it's quite a huge, quite a substantial amount of money. If you look at, so the issue is to create a system at every district and have a review of the whole inventories and the stock thereof. I think the store management of every hospital is crucial, and this is where I think the government must improve its whole management, store management. It will help us to plug in all the loopholes that still exist in the system. We have been confronted by this problem in the past. We still continue to be confronted by this same problem. That's why I'm bringing this very important observation that I have. And in fact, recently I had a privilege to travel to Resu, the constituency of our Honorable Deputy Speaker himself. So I met some of the patient parties. Wrong PHC. Wrong PHC, when we're talking about MHIs, we're talking about the free medicine, then they confronted me with a question. Sir, is it available? But we don't have even doctors in Rongrong. Rongrong PHC, medical and health officers posted are not available for the patient parties. They go to Resu, so-called 100-bedded hospital, which is yet to be fully functional, pending the inauguration of the project. I'm made to understand that the Honorable Minister in charge have recently visited that particular headquarter, district headquarter, and also have taken stock of the various medical infrastructure. So these are things. Now, why is it that it is possible for the medical and health officers to remain absent and not to go to the PHCs where they are posted? I'm pained to see. In fact, I used to share this concern with most of my professional friends since I belong to medical profession. See, one message has to be sent to our beloved doctors, which should be loud and clear. Doctors who have been privileged to become medical professionals because of the state quota, because of the seats available. Well, there are some parents who have tried to at least provide this medical education, even though they were not in a position to get the seats out of the state's allotment of quotas for pursuing medical education. But most of us, I'm a doctor today. If there was no such state quota, I would have never become a doctor. I think it's very important for us to remind ourselves, remind the medical professionals as to why we are there. Why are we still supporting? Because we have a problem of providing the access of healthcare to our beloved people. So therefore, Mr. Speaker, sir, I would like to request the Minister in charge of Health, keeping in mind this only one point. Now, if I keep on talking about many PHCs, same thing happens. Same thing. It's not only wrong. It's not only wrong. It happens in Songsak PHC. Songsak PHC, sometimes they decide who should attend, who should not attend. If there are two medical and health officers, what is happening? One doctor will be there, another doctor will have their own holiday. What is this happening? How are we doing justice? Therefore, lest it becomes a normal practice. This abnormal practice is becoming a normal practice. Very dangerous trend. Then another thing, that money which is sought for is to take care of the additional requirement to continue implementation of MHIS. I'm happy that we are still implementing this program. But having been instrumental in authoring this particular very important initiative for the state, the whole concept has been to design an universal health insurance coverage to everyone. Somebody asked me, why not government employees? Government employees are already covered. Government employees are already covered. They have the medical reimbursement, etc., etc. So everybody is covered. But here again another problem which somehow by default deprive the patients, the patient parties. How is it being deprived? Now when the patients go to the hospitals, whether it is PHC or CHC or civil hospitals, what is happening? I think all of us know. All of us in this August House know what is happening. The patient parties are referred. Now they are referred. Mr. Deputy Speaker, sir, I would like to bring it to the notice of this August House and to everybody through this August House. When we decide to refer a patient, we will always ask the patient party. We will always also determine their socio-economic status. That is how we are taught. Only after knowing the socio-economic status, then we will be tempted to ask the patient party whether you would like to get your patient referred for further education, further investment and treatment to a private hospitals, whether it is Valor or Apollo or wherever. But when we know that patient party belongs to socio-economically weaker section of family, our job is to advise them to go to the referral centers, which are government referral centers. I'm happy to see that there is some initiative that community health centers are actually being supported to provide this support. PHC to CHC, CHC to civil hospitals or district hospitals, then to state hospitals if any or otherwise tertiary referral centers are the medical hospitals. Why are not the doctors referring the patients to medical hospitals, to the tertiary hospitals? Today we are fortunate to have more medical colleges. Today some of the medical colleges in Assam are doing brilliant works. Some of the cases which were proposed to be referred outside Northeast, we managed to talk to the professors, HODs, and managed to get the treatment in Guwahati Medical College. Wonderful facility. Kudos to the government. Now here we have Negrims. It is supposed to be a center of excellence. They have a counter for MHIs. But the problem is what? When the patients come, patients from the villages, I make it a point to always advise my patient parties to always come to government referral centers, including Negrims. Now, after seeing the patient, they will say, come after 2 weeks for ultrasound, come after 2 weeks for CT scan. What is this? Will they go and come back? This needs to be corrected. Now, I try to find out from the Negrims as to what is the actual problem. There is a problem. But I think government should put their foot down in preventing the exodus of the doctors, exodus of the HODs. This is happening. How many medical colleges are being established in Assam? Without even looking at whether do we have the teachers available to really run those hospitals, we are going to have a serious, serious problem. Therefore, while we look at this huge gap is again because we also, though have specialists in different civil hospitals. Now, when we send our patients to civil hospital, Williamnagar, the main problem is the anesthetist. So therefore, please look at this MHIS concept, how it has been designed. This concept has been designed in order to make health delivery system sustainable for the state. Let us remember that providing access to quality and affordable health care has been a challenge for every nation, every country, including the most richest nations, including America. So therefore, providing healthcare facility must be affordable for the state government. Now I see that the government has definitely projected what would be required for funding this program under MHIs. Why are we needing more? We are needing more because of the resultant increase in the premium that we pay. Because of the resultant increase of premium due to the resultant increase in the claims. Now, how these claims being processed has to be seen. I'm telling you, Mr. Speaker, sir, I'm telling everyone in this August House, through you, Mr. Speaker, sir, this particular scheme should not be weakened in any way because this is the best conceptualized and designed health insurance program available in the whole country and whole world. Because the money, if suppose a patient has been referred and has been treated in, I was very happy to see how this MHIS fund was utilized by the civil hospital Williamnagar. They showed me, sir, this is the bed we have bought. This is this infrastructure we have created out of the fund of MHIS. So how do the MHIS fund ultimately become accessible for the health management, hospital management committees? Because it has been designed in such. One particular percentage goes for the hospital management to take care of their requirement in respect of infrastructure, etc., etc. One portion goes also to incentivize the manpower, the doctors, the nurses, the paramedics. So it has been designed. That means every patient that they treat and treat under the coverage of MHIs, that is going to generate certain amount of revenue to the hospital. That revenue, how they are utilizing is one part, and the fact is that this revenue is crucial. That means whatever we are spending is coming back to the government hospitals. So therefore, government hospitals must be encouraged to ensure that the patients who are going there for treatment are taken care of, are treated. I had the privilege of visiting, when we launched these MHIs, visiting some of the hospitals to see how many hospitals are really taking advantage of these MHIs. Now, one big eye-opener was that when I visited Holy Cross, Mairang, they were doing wonderfully well. there were only 5 doctors. But there, in the particular financial year, till the time when I visited as a chief minister, that time their reimbursement was plus 20 lakhs. And when I checked up with Civil Hospital Shillong, it was 17 lakhs. How many doctors are there in Civil Hospital Shillong? Why? Because we were not invoking the benefit of MHIS. Then we had a review. So this is how the department can review this. This is how the minister can review it. So my suggestion is that please do so and find out. If any hospital is not showing enough reimbursement, that means they are not utilizing MHIS. Therefore, what we are doing, passing of this money, voting for this demand, they must be utilized everywhere. Mr. Deputy Speaker, I earnestly request, let us effectively utilize this program. And another part is that referral system must be corrected, lest we end up patients surrendering to disease, taking back their patients, waiting for the unfortunate day. This is exactly what is happening, Mr. Deputy Speaker. So I think with few of this observation of mine, I'm sure the department will be enriched, the minister will be enriched. There are many more things we can always discuss and further share our ideas, but please take care of this whole benefit of the programs and ensure that the doctors are in station, because otherwise, whatever amount of money is being put forward as a demand and the mandate from this August House through the voting will be not passed on as a benefit for all those who need them most, particularly the patients in the rural area. And another part is that this money which is proposed to be spent for the medicine, now the explanatory notes indicate that due to notification of Meghalaya Medical Drugs and Services Limited, whereby all purchases from 1st March to 2023 onwards will be handled by the said corporation, and the pending liabilities before 1st March 2023 will be borne by the directorate. That means there is a transition in the process of procurement. We hope that every new system adopted is much better, much transparent. I will expect that transparency is maintained, and at the time when we transit, please take care of the liabilities for the pending bills. Our entrepreneurs, our businessmen who are doing medical supplies or any supply, whether it is in CNRD, those MGNRGs, material supply, they are not flush with money. They are doing with limited amount of capital. Once their capital is blocked, their whole entrepreneurship spirit gets completely, dampened. That is not good. That is a warning signal for all of us. Therefore, do not keep the bills pending. This bill pending may be because of nepotism, because of favoritism, which is true, which many of us know. I don't want to further elaborate. Please, let us get out of this practice. We never did it during our time. In fact, Sports and Youth Affairs had liability, which was pending since 1993, 94, 95. We cleared it during our time. So I would like to request, Honorable Minister, please take care of the liabilities. Please clear them so that our entrepreneurship promotion endeavor really give fruition to our objective and our intent. Thank you, Mr. Deputy Speaker. Sir, with these few words, I support this cut motion.
Thank you. Sir. Sir.
Yeah. No need.
Sir, I also rise to support the cut motion brought by the Honorable Member from Umsning, Dr. Celestine Lindo. So just a few suggestions, rather observations to the Honorable Minister. Sir, some of our patients have gone outside the state for treatment. Some of them are suffering from cancer, and then they come to us for assistance. In fact, since the CNRD Minister is here now, I had submitted a proposal, certain amount to be allocated to help financial assistance to the patients. But the DC wrote to me that it is not under the SRWP guideline. Fine, okay. So I will request the Minister, the Chief Minister to review this. Madam, if you can look at this, some of this institute, especially cancer hospitals treating cancer, MHIS is not applicable there. Sir. So they come to us, and then, cancer treatment is very expensive. So some of these hospitals, if they can be empaneled, that will, help them, get the treatment without imposing financial burden on the families. Another point, sir, which is, it so happened my daughter is a doctor in PHC, and she told me there is no heating system in the labor room. And you can imagine, madam, you're a mother yourself. In winter, when there is no heating system, I think that puts a lot of, inconvenience or rather uncomfort to the mother who are delivering babies. And then another point is, like the honorable member from Songsak has just said, former Deputy Chief Minister, that sometimes puts a lot of pressure. For example, now a PHC that has only 2 doctors. If one of the doctors is on leave, so the burden is on, the doctor all alone. So if, for example, a doctor avails leave, I think, it can be deployed so that another doctor is sent there so that to provide healthcare to the patients. These are some of the observations I would like to suggest so that, we ensure that people who, because people who go to the government healthcare centers are mostly people who come from the poor family background. And if they don't avail the treatment there, then it puts a lot of pressure on them to go to private hospitals, which are very expensive. Another point I'd like to point out, we have had patients, from our constituencies who come to us, Mr. Speaker, sir, saying that when they go to civil hospital, for a simple X-ray, they are sent to private hospitals. So ensure that, these facilities, basic amenities are available at our government hospitals so that our poor patients who go to the civil hospitals, to the government hospitals, are given the health care that they require. These are some of the suggestions that I have to put to the Honorable Minister to ensure that we provide health care to our people in the government hospitals. Thank you, sir.
No more members? May I know the mind of the mover as to whether he will withdraw the cut motion? Oh, sorry. Oh, I'm sorry. I'm sorry. The minister is yet to reply. Please. I'm sorry.
Honorable Speaker, sir. I would like to thank the Honorable Member from Umsning, Dr. Celestian Lingdo. And we are grateful to Dr. Mukul sir, MLA of Songsak, who also has contributed a lot of food for thought for the department, and also our respectable LO, Mr. R.V. Lingdo, for participating in this very, very important cut motion debate. I have taken note of all the points that have been raised, sir, and it is in the practice only that we have to defend our efforts as a government. And having said that, suggestions given for the good and improvement of the department and our facilities is something that we will always accept, take in good spirit, in the interest of the people that we all serve. So the egg or the chicken anecdote of the Honorable Dr. Celestian, sir, I understand that there is this concern. I have also visited Parila, MCH Hospital at Umsning. In fact, we had gone just before Christmas. There was no saying that we would make it a Christmas gift, but I had said that yes, we would give it our best. But you have seen, we have also together gone to Nongpo Hospital. I went with the Honorable Member to Nongpo also, sir. And it is very clear that this distant location of the MCH from the civil hospital is going to be a big cause of concern. Because the moment we take these doctors from this facility and take them to that facility, there's going to be a problem with management of then the civil hospital Nongpo. And I want to assure the honorable member from Umsning that, sir, I have taken this up.
Minister, please. It is already past 4:30 p.m., but I will allow the minister to complete her reply and bulletin the other demands later. Please
Thank you,
continue.
Speaker, sir. And the proposal for HR at Parila is now already processed, and as Honorable Chief Minister himself has committed on the floor of this House, we are committed to ensuring that Parila gets operational at the earliest. Sir, you have also said at that time that there were other problems. You have a power problem, connection of power. There was a damage of the transformer. So all of that has been done. I think you're also aware. You have said that we need to improve on that connection of road stretch. That also we have done, sir. And you have also enlightened me that there has been theft in the quarters. And it is also something that we as a government now are already focusing on. Honorable Chief Minister has made it very clear that the investments henceforth into any of the institutions that we institute should have an entire package approach and should not have this disjointed approach, which is the cause for all of this delay in the operations of all of those beautiful buildings that I saw as I traveled the length and breadth of the state. So there is a chokidar, he is a caretaker, of course a temporary caretaker. I remember I met him, he said that it is very fearful for him to stay there alone. We've understood that. But sir, you kindly take it from me now that we are committed on operationalizing the Parila MCH at Umsning, sir. Very grateful to Dr. Mukul Sangma, Honorable Member from MLA from Songsak, sir. It is true, some of the observations that you have made are going to be a big inspiration to all of us. I know that there is, obviously, even you have understood and you have observed that there is a marked improvement in our systems. And so you had mentioned that Rongram PHC, there is no doctor, but sir, it's not true, there is a doctor. And in fact, we've had several cases of newborn deliveries in the health facility just very recently. And so yes, I'm happy that you have also seen how the MHIS funds and the savings of institutions have further assisted our doctors to ensure that they utilize those funds correctively and build on the institution with that interest. So we also have observed that this is a fact and that we are doing much better. So you have also said that usually these institutions, the Rongram institution is not doing well. So we also have 3 staff nurses, we also have a pharmacist and other staff also, sir. And I will definitely get back with the officials to find out why your observation is such. But I can assure you that we will be on the job. And we also, sir, as you yourself have understood the system, we have institutioned a new dispensation for procurement of drug. These drugs are being made available to all our institutions through a dashboard. At the press of a button, sir, you can actually see the indent made from all the facilities around. And I have myself just recently traveled to some of the institutions on surprise visits. And I've asked whether they have these medicines on the essential drugs. So we are updating our essential drugs periodically, sir, because we would like to make sure that essential medicines are going to be made available for our citizens. So, sir, we are with you when you say that we need to request our doctors to start performing to the best that they can. And I'm so happy that you, such a senior physician and also a legislator in this state, sees the need to send a SOS call to doctors, requesting them to please attend to the patients that throng to their health facilities. Our OPDs across the board, sir, are improving. Our IPDs are substantially also increasing. In fact, some of the interventions that the department, through the intervention of Honorable CM, has initiated, all of that is working very well. We also have the drone facility, sir, where we deliver medicines to out-of-reach locations. We have done that as well, sir. Sir, we have also instituted a systematic redressal of waste of medicines to ensure that the state does not waste its funding on procurement of medicines. So, the MHIS coverage in the state today stands at the highest. We are coverage at 73%. And in 22-23, we have seen the highest numbers of claims, touching 180,000 numbers this year alone. So last year we had the highest value of claims as well, and all of these claims are now being given back to these institutions to improvise on their own systems. You are talking about Mairang. Please go back to Mairang. I just went recently. Fantastic operation theaters, state-of-the-art testing facilities. Must thank the member of Mairang also, who likely is supervising that very well. So we have said that we are committed and we will continue to work with vigor and with complete dedication. Please do not fall prey to gossip about nepotism in the department. There is no such thing as nepotism in our style of functioning, sir. We work with one mind, and that is whoever is deserving and whatever pending bills there are, whenever these payments are made to the engineering wing, get released to the right quarters without any favoritism, any biasness. Please take that as a mission of the department, as I have been privileged to sit as the leader of this department. So you were talking about the inadequate availability of medical officers in specialized services. I think you must be aware that recently we have upskilled our medical professionals as part of our health plan and sending doctors for certified short-term programs, especially in gynecology and in anesthesia, sir. And today our doctors have returned back after 4 months or 6 months programs with better life-saving anesthetic skills and other medical skills. They are doing very well in some of our CHCs, PHCs, sir. I remember the one in Smith also. We're doing very well. We have ultrasound facilities. So on the matter of referrals, so it is difficult to say whether it is the institution that is referring our patients or whether it is the patient who's refusing medical treatment in our institutions. I am personally aware of many critical cases of cancer, kidney problems, where citizens prefer on their own to go out. Most of our government employees also, sir, prefer to go out, and our heads of institutions are finding it difficult to put their foot down on the essential certificate for them to go for these treatments outside. We are trying our best to communicate to the public that if we have the facility in our state, why are you not availing it in the state? But it's a difficult task. Now that I have been minister of this department for this long, I know that several patients do not have faith in our system. We are working on it to change the look of the system and to reassure our public that we will give them the best of the best. You have seen we have done some fantastic surgeries in Maukarwat recently, something which was never done in the past. You are aware of the Jinjal facility. Nobody ever imagined that that could happen. We are changing the systems, and we are trying to ensure that there is confidence in the public to come to our systems. Sir, I hope that I have just touched upon some of the things that you have highlighted, and believe me, we are available for a consult at any point of time where you think there is an urgent requirement for such a consult. Honorable Leader of Opposition, sir, you have just heard what a senior physician and legislator, policymaker has said about the MHIS funds in every institution. We will talk to this institute where your daughter is working, and we will request that the MOs and the medical staff there to utilize, because I have been to several labor rooms. I went recently to a very far-flung PHC and CHC, sir, and I have seen that there as well, the staff, the MOs are trying their best. There is no ways that the operation theatre cannot access a good heater, sir. It is not correct. Now we have to make sure that we give power to our MOs to tell them that you are in charge of this institution and you have to do this work. We will try to give them that kind of a confidence so that they will work well. Sir, I have just recently also taken an equipment audit at Civil Hospital. I am aware that because of some difficult situations, this information doesn't come to us, but I can assure you, sir, that in the leadership of our Honorable Chief Minister and me as the Lieutenant in charge of this department, we will leave no stone unturned to ensure that our facilities are working and performing and serving the people and doing the thing that we have to do. Because of a paucity of time, I wouldn't like to go through some of the good things that this department is doing. I think we have had an opportunity again and again to rise and share with the citizens of the state the good things that the Department of Health is now doing. I will leave it for another opportunity, and I will seek, sir, that the mover of this cut motion should feel it necessary with the requirement of these funds that you will withdraw the cut motion that you have placed before the August House this evening. And with these few submissions, Honorable Speaker, sir, I resume my seat, sir.
Thank you. May I know the mind of the mover as to whether he will withdraw his cut motion? Just you want clarification?
Because I would like to thank the Honourable Minister for a sincere attempt for the comprehensive reply to the points raised. In respect of wrong, I am aware that the doctor is posted, but the people do not know the existence of the doctor. That means, isharai kafi hai. You know, there may be also with other PHC. That is one. And pertaining to referral, the problem of effectively utilizing the facilities, I think negrims must be taken up in the right earnest so that we benefit out of it. There's a huge exodus of doctors from here. Therefore, diluting their capacity. That's the only point which I wanted to raise further. Kindly take note of it and take measures.
Honorable Speaker, sir, I would like to appraise our Honorable MLA, Dr. Mukul Sangma, sir. Today, in fact, I left the House to go and sit with the Honorable Minister of State who was in the state in a certain function, and I have taken up this matter with her. And last time as well, she came and she did take some action. So, sir, I want to assure you that Honorable Chief Minister is well versed of this fact and he is in constant touch with Negrum's institution.
So, the mover has, what is your mind, please?
Mr. Speaker, sir, after hearing the exhaustive explanation and a sincere initiative that the Minister will take care of our concerns, I will withdraw my cut motion.
Since the mover has withdrawn his cut motion, now let me put the question before the House. The question is that grant number 13 be passed. Those who are for the motion say aye.
Aye.
Those who are against say no. The ayes have it, the ayes have it. The motion is carried and grant number 13 is passed. Voting on demand for grants is now closed. The remaining demand for grants will be disposed of applying sub-rule 3 of Rule 144 of the Rules of Procedure and Conduct of Business in Meghalaya Legislative Assembly. That is demand numbers 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Do stand bulletin. I will now put the question before the House. The question is that demand numbers 14, demand number 15, demand number 16, demand number 17, demand number 18, demand number 19, demand number 20, demand number 21, demand number 22, demand number 23, demand number 24, demand number 25, demand number 26, demand number 27, demand number 28, demand number 29, and demand number 30 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and demand number 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30 are passed by the House. For the list of supplementary demands for grants and supplementary appropriations, revised estimates for 2023-24, voting on demands for grants is also now closed. The remaining demands for grants will be disposed of by applying sub-rule 3 of Rule 144 of the Rules of Procedure and Conduct of Business in the Meghalaya Legislative Assembly. That is demand number 1, demand number 2, demand number 3, demand number 4, demand number 5, demand number 6, demand number 7, demand number 8, demand number 9, demand number 10, demand number 11, demand number 12 do stand guillotined. I will now put the question before the House. The question is that demand numbers 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 be passed. Those who are for the motion say aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and demand numbers 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 are passed by the House. Now we come to item number 9. Sri Cornet K. Sangma, Chief Minister in charge, Finance, to beg leave to introduce the Meghalaya Appropriation Number 1 Bill 2024. Chief Minister, please.
Mr. Speaker, sir, I beg leave to introduce the Meghalaya Appropriation Number 1 Bill 2024.
Motion moved. Let me put the question before the House. The question is that leave be granted to introduce the Meghalaya Appropriation Number 1 Bill 2024. Those who are in favor say aye.
Aye.
Those who are against say no. The ayes have it, the ayes have it. The motion is carried and leave to introduce the bill is granted. Chief Minister, to introduce the bill, please.
Mr. Speaker, sir, I introduce the bill.
Commissioner and Secretary to read out the title of the bill.
The Meghalaya Appropriation Number 1 Bill 2024 is introduced.
Now we come to item number 10. Sri President Tungsong, Deputy Chief Minister in charge, Parliamentary Affairs, to move, please.
Mr. Speaker, sir, I beg to move that the second proviso to sub-rule C of Rule 72 of the Rules of Procedure and Conduct of Business in its application to the Meghalaya Appropriation Number 1 Bill 2024 be suspended for the time being insofar as the rule requires circulation of the bill 4 days in advance before the motion for consideration removed.
Motion moved. Let me put the question before the House. The question is that the second proviso to sub-rule C of Rule 72 of the Rules of Procedure and Conduct of Business in its application to the Meghalaya Appropriation Number 1 Bill 2024 be suspended for the time being in so far as the rules require circulation of the bill 4 days in advance before the motion for consideration may be moved. Those who are in for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it, the motion is carried and the motion for suspension of Rule 72C of the Rules of Procedure of Conduct of Business is adopted. Now we come to item number 11. Let me read out the message from the Governor. Dated 16 February 2024. Order in exercise of the powers conferred by Clause 3 of the Article 207 of the Constitution of India, I, Sri Pagu Chauhan, Governor of Meghalaya, do hereby recommend to the Meghalaya Legislative Assembly the consideration and passing of the Meghalaya Appropriation Number 1 Bill 2024. Signed, Pagu Chauhan. Sri Conrad K. Sangma, Chief Minister in charge, Finance, to move that the Meghalaya Appropriation Number 1 Bill 2024 be taken into consideration. Chief Minister, please.
Mr. Speaker, sir, I beg to move that the Meghalaya Appropriation Number 1 Bill 2024 be taken into consideration.
Motion moved. I will now put a question before the House. The question is that the bill be taken into consideration. Those who are in favor say aye. Aye. Those who are against say no. The ayes have it, the ayes have it, and the motion is for consideration is adopted. Now we come to item number 12. Sri Conrad Sangma, Chief Minister in charge Finance, to move that the Meghalaya Appropriation Number 1 Bill 2024 be passed.
Mr. Speaker, sir, I beg to move that the Meghalaya Appropriation Number 1 Bill 2024 be passed.
Motion moved. Now let me put a question before the House. The question is that the Meghalaya Appropriation Number 1 Bill 2024 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and the Meghalaya Appropriation Number 1 Bill 2024 is passed. Now we come to item number 13. Let me read out a message from the Governor. Dated 16 February 2024. Order. In exercise of the powers conferred by Clause 1 of Article 207 of the Constitution of India, I, Sri Pagu Chauhan, Governor of Meghalaya, hereby recommend to the Meghalaya Legislative Assembly the introduction of the Meghalaya Appropriation Number 3 Bill 2024. Signed, Pagu Chauhan. Sri Conrad K. Sangma, Chief Minister in charge, Finance, to beg leave to introduce the Meghalaya Appropriation Number 3 Bill 2024. Chief Minister, please.
Mr. Speaker, sir, I beg leave to introduce the Meghalaya Appropriation Number 3 Bill 2024.
Motion moved. Let me put the question before the House. The question is that the leave be granted to introduce the Meghalaya Appropriation Number 3 Bill 2024. Those who are in favor say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and leave to introduce the bill is granted. Chief Minister, to introduce the bill, please.
Mr. Speaker, sir, I introduce the bill.
Commissioner Secretary, to read out the title of the bill.
The Meghalaya Appropriation Number 3 Bill 2024 is introduced.
Now we come to item number 14. Sri President Tungsong, Deputy Chief Minister in charge Parliamentary Affairs, to move, please.
Mr. Speaker, sir, I beg to move that the second proviso to sub-rule C of Rule 72 of the Rules of Procedure and Conduct of Business in its application to the Meghalaya Appropriation Number 3 Bill 2024 be suspended for the time being insofar as the rule requires circulation of the bill 4 days in advance before the motion for consideration may be moved.
Motion moved. Let me put the question before the House. The question is that the second proviso to sub-rule C of Rule 72 of the Rules of Procedure and Conduct of Business in each application to the Meghalaya Appropriation Number 3 Bill 2024 be suspended for the time being insofar as the rule requires circulation of the bill 4 days in advance before the motion for consideration may be moved. Those who are in favor for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and the motion for suspension of the Rule 72C of the Rules of Procedure and Conduct of Business is adopted. Now we come to item number 15. Let me read out a message from the Governor. Dated 16 February 2024. Order. In exercise of the powers conferred by Clause 3 of the Article 207 of the Constitution of India, I, Sri Pagu Chauhan, Governor of Meghalaya, hereby recommend to the Meghalaya Legislative Assembly the consideration of the Meghalaya Appropriation Number 3 Bill 2024, signed Pagu Chauhan. Sri Conrad K. Sangma, Chief Minister in Charge, Finance, to move that the Meghalaya Appropriation Number 3 Bill 2024 be taken into consideration. Chief Minister, please.
Mr. Speaker, sir, I beg to move that the Meghalaya Appropriation Number 3 Bill 2024 be taken into consideration.
Motion moved. I will now put the question before the House. The question is that the bill be taken into consideration. Those who are in favor say aye. Aye. Those who are against say no. The ayes have it, the ayes have it, and the motion for consideration is adopted. Now we come to item number 16. Sri Conrad K. Sangma, Chief Minister in Charge, Finance, to move that the Meghalaya Appropriation Number 3 Bill 2024 be passed. Chief Minister, please.
Mr. Speaker, sir, I beg to move that the Meghalaya Appropriation Number 3 Bill 2024 be passed.
Motion moved. Now let me put the question before the House. The question is that the Meghalaya Appropriation Number 3 Bill 2024 be passed. Those who are for the motion say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and the Meghalaya Appropriation Number 3 Bill 2024 is passed. Now we come to item number 17. Sri Rakham A. Sangma, Minister in Charge Education, to beg leave to introduce the Captain Williamson Sangma State University Amendment Bill 2024. Minister, please.
Speaker, sir, so I beg leave to introduce the Captain Williamson Sangma State University Amendment Bill 2024.
Motion moved. Let me put the question before the House. The question is that the leave be granted to introduce the Captain Williamson Sangma State University Amendment Bill 2024. Those who are in favor say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and leave to introduce the bill is granted. Minister, to introduce the bill, please.
Sir, I introduce the bill.
Commission Secretary to read out the title of the bill.
The Captain Williamson Sangma State University Amendment Bill 2024 is introduced.
Item number 16. Now let me read out a message from the government. Dated 16 February 2024. Order. In exercise of the powers conferred by Clause 1 of the Article 207 of the Constitution of India, I, Sri Pagu Chauhan, Governor of Meghalaya, hereby recommend to the Meghalaya Legislative Assembly the introduction of the Contingency Fund of Meghalaya Amendment Bill 2024, signed Pagu Chauhan. Sri Conrad K. Sangma, Chief Minister in Charge, Finance, to beg leave to introduce the Contingency Fund of Meghalaya Amendment Bill 2024. Chief Minister, please.
Mr. Speaker, sir, I beg leave to introduce the Contingency Fund of Meghalaya Amendment Bill 2024.
Motion moved. Now let me put the question before the House. The question is that leave be granted to introduce the Contingency Fund of Meghalaya Amendment Bill 2024. Those who are in favor say aye. Aye. Those who are against say no. The ayes have it, the ayes have it. The motion is carried and leave to introduce the bill is granted. Chief Minister to introduce the bill, please.
Mr. Speaker, sir, I introduce the bill.
Commission Secretary to read out the title of the bill.
The Contingency Fund of Meghalaya Amendment Bill 2024 is introduced.
We come to item number 19. Sri Preston Tungsong, Deputy Chief Minister in charge, Public Works, Roads, to lay the 44th annual report of the Meghalaya Government Construction Corporation Limited for the year 2021-2022. Deputy Chief Minister, please.
Mr. Speaker, sir, I beg to lay the 44th annual report of the Meghalaya Government Construction Corporation Limited for the year 2021-2022.